I'm going to be going over the post-op instructions for CO2 laser resurfacing for full face specifically. I'm going to review the products that you'll be using after, as well as some important aftercare instructions. So first thing you're going to receive from us is these two products right here. We have the lipid ceramide serum, and then we also have the squalane gel. So these two products are very important for your care afterwards. Now, when you leave our center the day of the laser treatment, you are going to have a layer of Aquaphor on your face. We put this on right after the treatment. Only thing you're going to have to worry about that first day is touching up what is already on your face. So it's not going to be Aquaphor you'll be using. This product right here is going to replace Aquaphor. So you'll just need to touch up, when you get home or later in the evening if you feel like there's not as much on there as there was. We just want to make sure that you have something on your skin at all times to make sure it's staying nice and hydrated. Now, starting the next day is when you're going to start the cleansing process, and then you're going to be using these products alternating. So just to give you an example, so the next morning when you wake up, we're going to have you wash your face, lukewarm water, not too hot, not too cold, fingertip pressure, and you're just going to wash all that Aquaphor off your face. You shouldn't be using any washcloths, any exfoliators, any scrubby type things on your face. We don't want anything that's too harsh. You should only be using your fingertips. So once you wash your face, you can gently pat it dry. So you shouldn't be using anything to scrub your face. Just gently pat it dry, and then you're going to apply the squalane gel again. So once you apply this product, you're going to leave this on for most of your morning, and then maybe come lunchtime, you're going to wash your face again, same thing you did in the morning, fingertip pressure, lukewarm water, just kind of getting this off your face again. And then after you wash that time, you're going to be applying this lipid product. So a generous amount, it's thin, it's pretty silky, you don't have to do too much, but patients love this product and say it feels really good on the skin. And then maybe, a couple hours later, you're going to apply more of this. You don't necessarily have to wash your face again, but you could apply this again. And then maybe one more time, you can apply this again before you're going to repeat the cleansing process again. So morning wash, apply this. Then you're going to apply this throughout the day, and maybe wash one more time around lunchtime. And then at the end of the day, you're going to wash your face again with water, fingertip pressure, getting all the product off your face. And then you're going to apply this product again at nighttime before you go to bed. So the best way I can describe this is as a sandwich. So you're going to wash and put this on in the morning. This is going to be everything in between. And then you're going to use this product again as your bread at the end of the day. So you just want to make sure the goal is to always have something on your skin at all times, just keeping it nice and hydrated, making sure it's not getting too dry because it's already going to be dry from the laser. So key with the laser as well is your skin is going to peel over the first week. So you're going to have dry, flaky skin that's going to start to peel off. Number one rule is do not pick that skin off. It's going to be tempting, but you don't want to pick, you don't want to pull, just let that skin come off on its own. This will happen as you're washing your face and as you're applying these products. Now, you'll also receive post-op instructions specific to the laser. These cover a great deal of information. What I talked about in the cleansing process is in these instructions, as well as what you are to avoid and then what you can expect from the laser. Obviously, bruising and swelling is to be expected. Typically peaks around day 2, day 3, and then gradually gets better from there. And then also with the laser, number one thing, depending what time of year it is, you especially want to avoid the sun for 6 weeks after your laser treatment. So no direct sunlight to your face afterwards. That can be really damaging to the skin, so we got to make sure we're protecting that skin and treating it as the fresh, gentle skin that it is. You should be sleeping elevated at night just to help with the swelling for the first week. So 30 to 45 degrees, sleeping propped up, just helps with the swelling at nighttime, and then after the first week you can discontinue that. Another big thing with the laser is makeup you should not be applying makeup for 10 days after your procedure. So after the first week, we will see you back in the office. We will evaluate where you're at in the healing process. Most people are peeled by that point, but some people take a little bit longer. So Dr. Frankel will meet with you and we'll, kind of evaluate where you're at, see if you're fully peeled. And if you are at the point that we want you to be at 1 week, we'll move you on to phase 2 of instructions, which we will go over at that appointment. And then Dr. Frankel at that point will clear you to apply makeup, but most of the time patients have to wait at least the 10 days to be able to apply makeup over the laser area. So I covered the important things for aftercare. Obviously, you will receive all this stuff from us, and if you review it and you still have further questions or something wasn't covered and you'd like to find out, then feel free, give our office a call, and we're always here to help.